high school, Belleville East, went to college at SLU for a couple of years and then transferred and graduated from SIUE. And then around my junior or senior year, I found out that PAs, in order to get into PA school, you had to have a certain amount of healthcare experience. So got a job working in the emergency room up in Granite City as an ER tech and worked there for a couple of years to kind of build up hours, and then went to PA school out in Ohio, actually. But because I'm from this area, they allow us to kind of set up the rotations wherever you want to. So I knew I was going to come home, like I said, so set up all my rotations on my own back home, and this was one of them I got, was with Orthopedics with this group, and they liked something that I did that day, and so I got lucky and picked up the job, and here I am. It is a common question, and I think that there's a certain amount of people that are very confused by what a PA is and what we do. And the way that I explain it to people is, when you graduate from college, you have two different routes. You can go to PA school or you can go to medical school. The PA route was kind of more for me. And the beautiful thing about the job is that it's so flexible, and that collaboration with the physicians is always there. So, what patients should expect from a PA is somebody that is very well versed in all branches of medicine, but at the same time, we understand our roles as mid-level providers. So a patient needs to know that at all times, if there's any question that I have or anything, there's always a physician there that I can go to who's supervising me and kind of, looking after and signing my charts at the end of the day and stuff like that. So PAs they're a vital role in the coming times of healthcare. As far as the surgery aspect, obviously I'm not doing any surgeries. I'm a first assist in surgery, which means I pretty much as the doctor's right-hand man of what do you need. I'm trying to think a step ahead of them at all times. They're going to need this next, they're going to need this next. I do a lot of the closures after surgery, put the orders in after the patient gets done with surgery when they go to the floor. And then in the office, it's kind of a wide array of everything. Most of it's conservative type management for people that have arthritis of the knees or of the shoulders or whatever it may be, and they're not really ready to take that step of doing surgery quite yet. So I do a lot of injections, whether it be cortisone injections or like supplement injections. A lot of kind of diagnosing what's going on. Is the patient from the ER? Is it a rotator cuff tear? Is it something like that? Then I need to order an MRI so that I can go and discuss with the physician, hey, this person came in, they've got this, and this, kind of what do you want to do? Like it's kind of a collaborative effort between the two of us. So I do a lot of more of the conservative type management for things. And obviously the surgeons are doing more of the invasive surgery, stuff like that. But it's between the two of us, it's a good kind of combination as far as getting well-rounded care for a patient. I'm a sports nut, so whether it's at least 3-4 days a week, I'm watching Blues games, Cardinal games, and then weekends are taken by football towards the fall. So it's not much relaxing going on during games. It's a lot of high tense type, but I love it. I wouldn't trade it for anything, and that's what I live and die for during my off time.